For example, sir, in Simanchal, 4 districts, a population of 1 crore. Katiyar has only 57 PHCs, Araria 39, Kishanganj 16, and Purnia 51. Sir, CAG also reported multiple cases of fraud where dead people were given treatment under Ayushman Bharat, sir. Sir, the Prime Minister taunted Muslims and spread false news that we have more children. But this own ministry had said that the TFR for the country is falling and the TFR of Muslims has fallen the fastest. Some of them have the lowest fertility rate. Muslim women, this is, madam, you are the minister, you should know, National Family Health Survey 2019.
Ubaisi sahab, you are very
senior. पूछ रहे हैं तो मैं क्या करूं सर?
Only you address to the chair.
Thank you sir. मैडम को नहीं मालूम मिनिस्टर है.
ये है खबरों की खबर और आप देख रहे हैं खबरों की खबर टीवी.
मुझे समय दिया सभापति साहब.
So the Indian health expenditure, which was about 1.6 GDP and was budgeted to be 2.1 of GDP in 2023, is lower than 2.5 recommended by the National Health Policy 2017. And the 15th Finance Commission, sir, recommended 2.5 GDP by 2025. However, even this recommendation is consistently lower than China 3% and other countries, so Korea 5%. So the PMA BHIM scheme saw 22% reduction in allocation compared to BE of 23-24. Only 47% of the funds allocated in 23-24 utilized as per the revised estimates. So the NHM budget has been declining when adjusted for inflation. This has resulted in a situation where most PHCs and CHEs do not have adequate infrastructure or do not have basic human resources like doctors and nurses. For example, sir, in Simanchal, 4 districts, a population of 1 crore. Katiyar has only 57 PHCs, Araria 39, Kishanganj 16, and Purnia 51. One PHC is supposed to serve 30,000 people in Simanchal. Third point, the majority of Indians are forced to go to private hospitals. The majority of healthcare expenses are out of pocket. And this is the main cause of poverty and debt, sir. Sir, in Ayushman Bharat, 30,170 hospitals have been empaneled, out of which 56% are public hospitals. Shouldn't these hospitals already provide free healthcare? Standing Committee on Health also observed the hospitals were sparsely distributed across the country. CAG 2023 noted deficiency in the quality of infrastructure at several empaneled healthcare providers. Sir, CAG also reported multiple cases of fraud where dead people were given treatment under Ayushman Bharat, sir. Sir, as of August 23, 39% teaching, 49% non-teaching positions across AIIMS are vacant. Teaching vacancies are higher in campuses such as Madurai 77%, Jammu 61%, Rajkot 61%, and AIIMS and Bibinagar in Hyderabad has 45% staff, sir, vacancies, sir. Sir, the Prime Minister taunted Muslims and spread false news that we have more children. But this own ministry had said that the TFR for the country is falling and the TFR of Muslims has fallen the fastest. And may I quote and bring the notice of August House that the TFR rate of Muslims have fallen down from 4.41 to 2.36. The Muslim men use highest contraception than the Hindu people of 34.10%. Kashmir and Lakshadweep, some of them have the lowest fertility rate. Muslim women, this is, madam, you are the minister, you should know, National Family Health Survey 2019.
Ubaisi sahab, you are very senior.
पूछ रहे हैं तो मैं क्या करूं sir?
Only you address to the chair.
Thank you sir. Madam को नहीं मालूम minister है. Muslim women are now using contraception nearly as much as Hindu women, that is 60.2%. The truth, sir, is NFHS data says that Muslims lowest access to healthcare facilities due to poverty. Despite this, Muslims have better sanitation, they practice family planning, and because of this, Muslim children have lower infant mortality rates than Hindus. Unfortunately, NFHS data shows that neither in life nor in death discrimination stops. If a forward caste non-Muslim lives up to 50 and OBC Muslim only live till 43, Adivasis die 4 years sooner than the upper caste. Lastly, sir, I would request the Honorable Prime Minister to inculcate a scientific temperament as the Constitution Article 51 said. Let me remind this August South that Priyam once said that surgery is carried out on a human body when it is healthy. He had once said that plastic surgery and in vitro fertilization existed in the past. This is reflected today in the fact that 40 lakh Indians are estimated to have died during COVID thanks to Modi's rule. It is reflected in the fact that the government has still not taken any active steps to improve healthcare delivery in India, sir. This is what I have to say. Thank you.
Thank you. Sri Satish Gautam ji.